I want to discuss the dynamics of a bone marrow biopsy. And it's only because I had to have one. And I'm not going to go into the particulars as to why, because there's many reasons why somebody would need a bone marrow biopsy. You know, and this can range anywhere from certain cancers, lymphoma, leukemia, myelodysplastic syndrome, to certain autoimmune disorders within the red or white blood cells or platelets. These are all things that are within the bone marrow and within the blood work when your doctor does your total complete blood cell count, CBC. So, and my apologies for the sniffles, but I do have a little bit of a sinus infection, upper sinus infection, respiratory. So I come forth with the discussion about the bone marrow biopsy and the procedure itself because it's quite intimidating and it's very, very frightening. And it's something I never thought that I would ever face, I guess, you know, and it was something that I went through, and I had mine done at the doctor's office. Some doctors do them in the hospital. In my opinion, it should be done in the hospital, radiologically or sonographically guided, because the way it happened for me in the doctor's office was I was given a local anesthetic, and she talked to me while she did it and explained, as you know, after she made sure I was numb, what she was doing. And I'd asked her, I said, are you going to do a bone marrow aspiration, being that you're in there, because I don't want to ever go through this twice. And there are people out there who go through bone marrow biopsies countless times. It just depends, you know. It depends on the diagnosis. So I digress. Okay. The bone marrow biopsy itself is where they go into the most center part of your hip bone. It's the least compromised bone. It's a large bone. They go into the most center part and cut a piece of the marrow, which is like the spongy center part of the bone. The bone marrow aspiration is drawing blood from the middle of the bone. So I'd asked, you know, can you please do both, because we don't want to have to come back and let's be thorough in what we're doing, you know, because even though I'm not a doctor, I'm not stupid either, you know, and I knew in my heart, it was like, even though there was local anesthetic, I knew that this was not going to be a comfortable thing, and it indeed was not, you know. You're numb, and yeah, she explained that she was, you know, going in with one needle and going in with another, and then now cutting through the bone, and, you know, I could feel the pressure, and many times I had to have her stop and give me more anesthetic, because there's you know, and to go to the most center of a bone there's a lot of nerves, and any little wrong turn, I guess, going in there, you're going to feel that. In my opinion, you should be twilighted at the very least. And again, should be sonographically guided. She did this blindly. So, I had to go in 3 times. And the goal is to obtain at least 1 centimeter of marrow. At least the sample size be at least 1 centimeter or greater. Upon the 3rd attempt, she was only able to obtain less than 1/2 centimeter. Frustrated, and me completely exhausted because I was there awake, laying on my belly for nearly an hour. Should have been a 10-minute procedure. After all the prepping and numbing and this and that, the actual procedure of going in and getting this marrow is supposedly 10, 15 minutes, give or take, okay? It took almost an hour. And after the third time, I was like, enough. Please tell me that what you have is ample size to get accurate results so that we can have the correct and proper diagnosis for what is going on with my blood, my chemistries, and she told me, she says, there's a great possibility that we may have to redo this, but I will submit what we have and we'll go from there. But, be prepared for a phone call telling that, we'll have to reschedule this. And if we do have to redo this, then we will do it in the hospital with a sonographer guiding through imagery. So I was like, we should have done it in the first place. But, it's a scary thing because, like I said, there's many reasons why bone marrow biopsies are done. But when you're facing a bone marrow biopsy, it's they're trying to rule out some serious things or confirm something serious, whether it's a lymphoma, leukemia, or, rare blood disorders that are autoimmune, that are sometimes treated with steroids or colony factor type medications. It's not necessarily just about chemotherapy and radiation. And it's not necessarily about cancer. There's a lot more to it than that, But without a diagnosis, people just can't, live normal, healthy, productive lives with abnormal blood cell counts. And trust and believe what I'm saying here, because for me it has been a battle. And I guess, what prompted me to do this video is because I hadn't done one in quite a while. And I'm not out there looking for feedback, which is why I muted my comments section, I guess, Sometimes I just want to be heard. I'm not necessarily looking for feedback or anything. If I'm looking for that, I speak to people that matter to me in my life. Not saying that my viewers don't matter to me, because they do. But people that know me intimately, know me well, meaning family and personal friends. That's the difference, This is more an informative and personal perspective about what that felt like. I was terribly frightened. I went in the following Monday after Thanksgiving and have sought second opinion and gone to one of the best places in the country in March. So, for a third opinion. And it's just so ironic, about, taking life for granted, because it was a random thing, going to get blood work, physical, and you get this phone call. And your life changes. That type of stuff changes people, and it's either for the better or for the worse, and that's a choice. To either grow and become stronger and fight, or give up and say to hell with it and go down in flames. That's a choice. I'm a fighter. I'm a fighter. I live to see my 50th birthday, and I intend to be around despite until it is truly my time. But I am just not the kind of person that's just going to wave a white flag and say, I give up. If you're somebody facing something like that, just know that, many times many times they do bone marrow biopsies because they can't find answers through any other means of testing and resort to that, and your results may come back totally negative and you're totally fine, but yet you still have unanswered questions about what's going on with medical tip, so then they do other testing, but to just go through that in itself is a frightening thing, because when we hear bone marrow biopsy, we innately think malignancy. When it's, these tests are used to diagnose and or to rule out other diagnoses. So it just depends on what is going on, and it is a case-by-case basis. And everybody's experience with bone marrow, if you are fortunate enough to have been sedated, like through Twilight, as opposed to the local anesthesia, God bless you. I had to lay there, for an hour, and this doctor went my hip bone 3 different times. I did not get the ample size, so of course I went to another hematologist / oncologist, and in better hands, I believe, but I still have a third opinion to come. And that's their booked so far out. It's just one of those places. They booked very far out. A lot of people have different ailments, and it is what it is, but the person that did the bone marrow will never, although I thought she was quite good and informative, she had knowledge. She did not know what she was doing when she performed that particular procedure, which I'm where I'm at for a reason, and I'm sharing about this just for anybody that's facing that, just to hear one experience. It's not to scare. Trust in your doctor. I did. And hope for the best, Hope that they get it on the first try, not have to go in 2, 3, 4 times, or have to come back and do it again. And that you get answers. Ask a lot of questions. Depending on what your circumstances, ask a lot of questions. Do a lot of homework. Educate yourself, as knowledge is king, and your life can depend on that knowledge. And at the end of the day, it is about you. If you don't ask the questions, you're not going to have the answers on what to do for you, And I'm the kind of person, I've done a lot of homework based on my circumstance, and educated myself on all the many possibilities that this could mean, just based on what my blood count revealed. What the variables were, what the possibilities were, what the prognoses were for each and every possibility. And it's because it's about my life, and I want to be around. So, God bless you for taking the time to watch this video, and best of luck to you if you're one facing the same procedure.